Madam President, I get a fair amount of mail, and I received the other day a nice envelope from the Department of Health and Human Services addressed to Andrew L. Alexander, Jr., and my Nashville resident, with a nice brochure here. Medicare and the new health care law, what it means to you. Now, I'm one of those 40 million Americans who are 65 or older, so I'm a part of Medicare. And I was very interested to read the brochure because I spent a lot of time, as did the senator from New Hampshire and the senator from Montana, probably spent even more, on the new health care law. And as I read through this brochure, it didn't bear very much relationship to the way I understood the law that I voted on in the middle of the night on Christmas, just before Christmas Eve at the end of last year when we passed this health care law. This brochure, which has been mailed at taxpayer expense to 40 million Americans, is an attempt by the administration to explain that the health care law does what it doesn't do, or doesn't do what it does. And let me be specific about why I say that. Throughout the debate, those of us on the Republican side of the aisle said the health care law would cut Medicare, raise premiums, raise taxes, pass Medicaid costs on to states, and add to our national debt. Those on the other side said we were wrong. And since they had the votes, they passed the bill. It's now law. But let me take 2 or 3 examples from the mail I got the other day. The brochure claims in the first paragraph that the new health care law will result in, quote, increased quality health care. Well, that would mean to me, I would think, as I read that I, an individual on Medicare, or that I, an individual in the United States, would continue to have at least the coverage that I'm having today, and hopefully more. Yet Medicare's own chief actuary noted in an April 22 memorandum that without intervening legislation to correct the payment cuts in the new law, some providers would, quote, end their participation in the program, that's Medicare, unquote, with the effect of, quote, possibly jeopardizing access for beneficiaries. It looks to me like, if you want to be accurate in writing 40 million Americans about what's happening with Medicare, that you'd add that in there and say, you know, there's another view by the chief actuary of Medicare in the Obama administration. Chief actuary also concluded that 15% of Part A providers, we mean by those hospitals, skilled nursing facilities, hospices, home health agencies, may be unable to sustain their operation in the next 10 years as a result of drastic Medicare cuts in the new law. That doesn't sound like increased quality health care to me. Or number 2, the second paragraph of the brochure says the new health care law will keep Medicare strong and solvent. Now here's the truth, at least as we see it. The $529 billion in cuts to Medicare, no one disputes that we have those, are being used to pay for $1 trillion, when fully implemented over 10 years, health care bill, not to shore up Medicare. According to the same people who put out this brochure, you can't double count the Medicare cuts as both paying for expanding the health care delivery system and increasing the solvency of the program. I mean, common sense says that if you take $529 billion out of Medicare over the first 10 years, or $1 trillion out of Medicare over 10 years, when it's fully implemented, and you spend almost all of that on something other than Medicare, that's not the way to make Medicare more solvent, even if it's a new Medicare program. Any savings from Medicare, we believed, ought to be spent on Medicare rather than running up the fiscal deficit in Medicare. Or number 3, on the second page, the brochure says if you're in a Medicare Advantage plan, you will still receive guaranteed Medicare benefits. Now, this is one of the most disingenuous comments in the whole brochure. If you read that, one of 40 million people on Medicare, you think, well, my Medicare Advantage must be okay. But the truth is Medicare Advantage plans will have less generous benefit packages. According to the CMS, that's the group that puts this out, according to the chief actuary. He says it will result in less generous benefit packages. The Congressional Budget Office Director, Doug Elmendorf, testified fully half the benefits currently provided to seniors under Medicare Advantage would disappear. Under the proposal in the earlier bills by the senator from Montana, most of which are in this bill. Now here's the difference. They will come back and say, well, but we said guaranteed benefits. And they would be right about that. But guaranteed Medicare benefits are what everybody gets. If you want Medicare Advantage, which you pay a little more for, to cover your dental, vision, and hearing, or other extra benefits, that's why you buy Medicare Advantage. And the truth of the matter is the Medicare cuts in the health care law will limit plan choices and reduce benefits for almost 11 million seniors enrolled in Medicare Advantage on those extra benefits. So that's relatively 1/4 of all seniors in Medicare, and there are 40 million of us in Medicare. In my state of Tennessee, there are nearly 250,000 Tennesseans in Medicare Advantage who will lose those benefits. So it's not true, or at least it's disingenuous, that your benefits won't change. Your guaranteed benefits won't, but your extra benefits are likely to. And finally, it says the new law completely ignores the new law preserves and strengthens Medicare. Well, I also think that's disingenuous, Madam President, because the new law does not include paying doctors who serve Medicare patients proper compensation. We call this the sustainable growth rate, the SGR. Some people call it the doc fix. You would think that a comprehensive health care law would include proper compensation for doctors who serve Medicare patients, but it doesn't. Why doesn't it? It would have, according to the president's budget, added $371 billion to the cost of the bill and made it add to the debt, which we said it would, add to the debt. So, what do we do instead? We simply pass a health care law, the majority does, claim it doesn't add to the debt, expand a health care delivery system we all know costs too much already, and go on about our way. And we still have with us the big cut in payments to doctors, which will increasingly create for those on Medicare a sort of health care bridge to nowhere or to the emergency room, as we find Americans who are on the big government programs, Medicare and Medicaid, unable in the case of Medicaid or Medicare to find doctors who are willing to serve them at the lower rates. And in case of those who go to Walgreens in Washington State, a drugstore company that won't fill your prescription drugs because of the low rates. So, Madam President, I'm very disappointed that the administration, in its effort to make the health care law sound better, would send out what amounts to propaganda. There's a federal law against propaganda. It says annual appropriations can't be used for publicity or propaganda purposes within the United States. I know a little about that. When I was the education secretary in 1991 or 1992, I sent out what I thought was a very carefully written article to teachers about President Bush I's education program. And the Democrats in Congress hauled me up before the committee and had the General Accounting Office investigate me and castigated me for putting out publicity and propaganda in violation of the law. Some House members have written the General Accounting Office and said, this violates the law. I don't know whether it violates the law, but it doesn't tell the truth in the way that we Medicare beneficiaries deserve to have the truth told to us about what the health care law does. I'm disappointed in it. I would hope the Centers for Medicare and Medicaid Services would be more accurate in the future, would present a more balanced characterization of the law. And I'm sure during the rest of this year, there are going to be a great many Americans who take a closer look at this law and who agree with Republicans who said no to this because it will raise your premiums, raise your taxes, it will send new costs to states, and it will cut your Medicare. I thank the President. I yield the floor.